So I think there's several challenges to molecular testing. I think one of the key challenges is the time it takes to get the test back, particularly if the patient is having symptoms. Getting molecular testing and the appropriate turnaround time is critical. If you look at the guidelines for obtaining and getting back molecular testing, the recommendation is within 10 weeks. I'm sorry, the recommendation is within 2 weeks or 10 business days. So that's something, the speed at which you get it back is very important. And I think some of the challenges regarding the speed is also not just where the molecular testing is performed, but if a tissue biopsy is needed, getting that scheduled, having the procedure, having the pathologist look at that specimen, send out the appropriate specimen for testing, that all takes time as well. So as much as that can be accelerated through collaboration, multidisciplinary involvement, the better, because I think being able to obtain an accurate result in the shortest amount of time in a rapid amount of time, rapidly and quickly, is a critical goal to get potential new targeted treatments to patients. Well, I think the payoff to patients when treatment is based on appropriate molecular testing is substantial. So we have great new treatments for lung cancer patients where we're able to match the mutation or molecular aberration that's really driving the tumor with many approved drugs that target that molecular aberration, whether it be EGFR mutations, ALK translocations, ROS1 rearrangements. We have drugs that have high response rates, impressive progression-free survival that can really improve the quality of life and the duration of benefit in these patients. So I think that it's absolutely critical for molecular testing for these patients with advanced non-small cell lung cancer in order to match the patients with appropriately targeted therapies, which are either already approved or potentially can match new targets to clinical trials. Communication for molecular testing among medical oncologists, thoracic surgeons, pulmonologists, radiologists, and interventional radiologists is all critical to obtain molecular testing from tissue in a quick amount of time in order to get the results to the patient that can impact treatment. So, for us in an academic medical center, we're fortunate to have clinic with our thoracic surgeons and pulmonologists and other specialists that focus in lung cancer, so we're able to coordinate with them on a face-to-face basis in terms of moving this testing and these procedures forward rapidly. That's not always the case at every institution. One of the things that I recommend is a multidisciplinary tumor board where discussing these cases that need these biopsies with our pulmonologists, thoracic surgeons, radiologists and interventional radiologists in a multidisciplinary setting is critical and so everybody can be on the same page about where to biopsy, what to biopsy, and getting it done quickly in order to get the molecular testing results as soon as possible.